Lots to talk about with our own political analyst, Howard Fineman, the senior Washington correspondent for Newsweek magazine. And Howard, good evening.
Hi, good evening.
Howard, so the Republican plan is not to reform health care, but to reform the Republican Party in 2010?
Well, don't forget it's the RNC. It's the Rush, Newt, Cheney, as in Liz, Republican Party. And based on that RNC, the Republican strategy is to talk about racial fears and resentments, to talk about where Barack Obama was born, but not to really talk about health care. I talked to people on the Hill all day today, talked to Republicans as well as Democrats. Republicans claim they have a plan. They don't. They claim they're going to have a plan. They won't. Their whole strategy, David, is to stand on the sidelines with their arms folded while the Democrats try to work this thing out. That's their whole strategy. Is
Senator Inhofe's assumption even correct? I mean, if health care reform is something that Americans want and Republicans don't deliver it to them, how does that help Republicans?
Well, I don't think it does. And I think a lot of Republicans privately, when they're in their sort of non-tribal moments, will admit that. The problem is that the economy is in a big hurt locker right now, and people are concerned about their jobs in part because they're concerned about losing their health care. So it's a combination of economic fears and concerns, and one's related to their health care system. Yes, 85% of the American people have health care, but almost all of them are worried about either losing it or worried that the costs of it are going to bankrupt them. That is, and as I travel the country talking to people and as I study the polls here, that fear connected with the economy itself is what's driving politics today. Obama's on the right side of that, the Republicans so far on the wrong side of it.